Hello, and welcome to the Industry Innovators Podcast. I'm your host, Sarah Cornett. I'm the founder and CEO of SC Innovate, an AI consulting firm helping clients with every step of their AI journey. AI is revolutionizing the healthcare industry by enabling personalized treatment plans, improving early diagnosis, and advancing medical devices. There are groundbreaking opportunities to leverage AI in the medical field to enhance patient outcomes. Joining me today is my guest, Dr. Maalouf. Dr. Maalouf is the Vice President of the International Diabetes Foundation and the founder and president of the National Diabetes Foundation in Lebanon. She also holds leadership roles in the Catalyst 2030 organization in the MENA region and in the Lebanon chapter that connects social entrepreneurs on a global scale. Dr. Maalouf is incredibly passionate about utilizing innovative solutions like AI in the healthcare industry to improve overall quality of life. I'm thrilled to have briefly caught up with Dr. Maalouf to discuss the opportunities as well as some of the challenges of adopting AI in the healthcare industry. Please join me in welcoming Dr. Maalouf to the Industry Innovators Podcast. Well, hello and welcome, Dr. Maalouf, to the Industry Innovators Podcast. Thank you for joining me today.
Thank you, Sarah. I'm really happy to be here with you today.
Oh, wonderful, wonderful. Well, I'm excited to speak with you and learn a little bit more about your expertise and how it pertains to the world of innovation and AI. So, could you start off by providing a little bit of more background information about yourself?
With great pleasure. And actually, I do wear different hats, but I believe AI has a place everywhere. And everything we do nowadays, it's not the future, it's now. So I am currently a vice president at the International Diabetes Federation, as I am also the founder and president of the National Diabetes Organization in Lebanon. And at the same time, I collaborate with a huge network of social entrepreneurs across the globe called Catalyst 2030. And I happen to sit on the governing council and be the co-chair for the Lebanon chapter and the co-chair for the MENA region chapter.
Wow, that's amazing. And I imagine the different, international aspects and voices that you're hearing and such this amazing collective, network that you're having across the globe. So I'd love to learn
Right.
more about your experience with innovation and things that you're seeing in kind of the innovation space from the different, networks that you have and conferences that you're attending. So could you speak a little bit more about the innovation side?
Yes, I would like to focus at this stage on the health innovation because when we are in good health, we can do anything we want. And I would like to shed the light on how we can use technology and AI in the health system, in the health ecosystem. And I've recently attended the Precision Health Medicine conference in Qatar, in the MENA region, and it was fascinating to see the medical doctors speak about the need of technology in their implementation. At a certain point, one might think it's a threat to doctors somehow, and some of them do think so, but actually, it's amazing to see how we can benefit from the technology advances, from AI particularly, in order to have more precision. And the name says it all. Precision medicine, it's like the new thing in the health conferences. I hear a lot about it. I speak about it myself, and I do believe from the perspective of the president of an NGO that anything that can help us help the people living with any kind of NCDs, in my case, particularly diabetes, improve their quality of life. This is what I focus on, and many of us working in the field, QOL. And in order to do that, AI becomes imperative at this point. And we've seen and we've heard a lot about many digital health tools, and they are all AI based, we call them digital tools, but they are exactly what AI is about. So I believe we should be receptive. We should update our mindset in order not only to accept the place and the role AI plays nowadays in our lives in general, but to understand furthermore how important it is to help us improve our quality of life through, health tools or whatever you want to call it.
Right. Right. Wow. What inspiring words. And it's such an important message, right? Of understanding how this technology can really benefit us and our quality of life, like you mentioned. It's the use cases are amazing with AI that I've seen as well, especially in the diabetes side, just being able to help monitor and really help make our patients' lives, the better. Are there any challenges that you foresee in incorporating this technology with healthcare? Because I could see some, data issues. I've kind of heard that a little bit with the on the healthcare side. So, could you talk a
Yes.
little bit more about some of the challenges with that?
Actually, there are many challenges.
Yes.
We always speak with optimism, but there are many challenges. And I want to focus on the challenges where um, the mindset of the people, due to multiple factors, is not receptive enough to what is happening. For instance, or they don't have access to digital tools, to internet, to smartphones, because all of this is needed. Take, for instance, the example of the country where I come from, Lebanon. The last few months have been not only challenges, but it was like watching a horror movie live
Wow.
before your eyes.
Yeah.
So these people, we were trying to continue with our mission, shifting the way we do it to adjust with the situation. But when, let's say, we visit a school with displaced people, those people who are living with diabetes don't think of carrying their tools when they are leaving, fleeing their houses due to bombing over their heads. So this is one challenge. Another is, due to these surrounding problematics, they tend to neglect their health. So that is also a major challenge. Or in those remote areas where they care about surviving, no more. You can't ask them to attend a Zoom meeting about awareness, health awareness, or to download an app, which might be very useful. Don't get me wrong. I mean, I am all for this, but I'm talking about the challenges. Now, in normal settings, the challenges would be for the people first to accept the importance of AI.
Right.
Like, you need to go on with the train, not stand and watch it pass by you. So, especially with a certain age group, it is a challenge. And then we have the financial challenge that sometimes those services, most of the times, are not free. In very few cases, they can be. So, our role, I believe, as NGOs is to make those tools as simple and as accessible as they can be. Because simple is a key word. We might, underestimate it sometimes, but we need to think that people don't have enough literacy about AI, they don't have health literacy. So there are many things that you are offering to these people that might be very, very good, and they deep down acknowledge it, but there is like a block somewhere that we need to overcome in order for them to benefit from what we are offering. So yes, the challenges are great and they are too many sometimes,
Yeah.
but we need to continue. We need to be persistent, because thinking at the end of the tunnel, if you want, of the bright side, of how beneficial it can be, of how much it can improve the quality of life and the health of people and their whole lives in many of the cases. This is enough push, I think, to overcome any type of challenges that might come across.
Definitely. Wow. I mean, you made so many profound statements in what you just mentioned there. I mean, talking about how do you make this technology, available to everyone, no matter what the circumstances are. You talk so much about the education of AI, which is something, I'm pushing really hard to do within my, with my business as a consultant, as an advisor, of really, spreading the word about AI, from the most simplistic level, right? Really making sure people really understand this technology. I think there's a lot of fear when it comes to AI, and there's a lot of
Mhm.
trust issues with embracing this new technology. So I know I do as much as I can to sort of, bridge that gap and really be able to find, those areas where we can really use this technology for the best good and for the quality of our lives. And so I know that's something I certainly push to do within my own business. And so what are some of the ways we can kind of collaborate towards this bigger mission? You really talked about, there's all these hurdles and challenges that we need to overcome. So how can we, collectively work as a group to sort of come together, get through some of these challenges and really, stand up this system that really benefits the greater good for all with using this technology?
That's a great question, Sarah,
Mhm.
because in my position as vice president at the International Diabetes Federation, I have had the chance to visit many continents and to look firsthand to see, what are the needs, what are the challenges. So, in my opinion, the first point is to understand that there is no such thing as one size fits all. This is an individualized, strategy that we need to think of because the challenges in India are not the same that we in the Middle East are facing, and the challenges of Africa are completely another level. Even within, let's say, the MENA region, as I visit many of the countries, you have the high income countries like the GCC, whereas Syria, Yemen, Iraq, Lebanon, Palestine, they face totally different challenges because of their political, financial, economic, social situation. And you mentioned something very important. I can call it maybe a stigma around AI because first we need to tailor uh, the education, the strategies, anything we want to implement as per the area we are addressing, who is our target community. And second, we need to understand that first we have to eliminate the most urgent needs. Before talking AI, we need to see, do these populations have access to basic needs?
Right.
Because at that point, AI becomes a luxury. And it would seem like you are not feeling with those populations and what they are undergoing, or the way they are, their current situation, life situation. So again, let me say, as an optimistic person, as I am by nature, that the challenges are very big and they vary per region, per country, per rural or, centric areas. But at the same time, I know we are not there yet, but we are on the good path with AI. Like I see it happening fast. So we need to move fast as things are moving around. I know it's easier said than done, but I think we are doing it. And in my particular work about education within diabetes and NCDs, which are the non-communicable diseases, it's working slowly but firmly. It is working. So I'm very optimistic, but I understand the challenges.
Oh, that's amazing. I love that you're saying, that you're optimistic about all of this, right? Knowing this is a kind of an uphill battle that we're all facing with this, but seeing those wins, those quick wins, right? AI is not a silver bullet. It's not going to solve all of the problems, right? Really
Right.
understanding where is the greatest need, like you said, what's going to make the most impact, and then sort of like kind of going at it from an iterative perspective, which I love, really starting slow, making the most impact, and really starting to see those results in those areas. is. So I love your take on that. I love that you're bringing everyone together to really support this initiative. It's really, really inspiring.
Thank you, Sarah. Thank you. I know we have short time for this, but I believe the message is there. And just walk with AI.
Yeah.
Take it go hand in hand with it. Go at the same speed. It's not easy, but it's not impossible. And the benefits are there waiting for you. So this is my call to everyone who would be listening to this podcast. And thank you so much, Sarah, for this opportunity. I believe that you and I would be collaborating on different levels because I believe in what you're doing, and I believe in the benefits and the great impact that those actions will have on the community at many levels. So thank you
Oh
very
man.
much.
Thank you so much for joining me. I mean, I've learned so much from you today. I know our listeners are going to be really excited to listen to this session. I'm so excited to have you on. I'm so excited to collaborate with you in the future. I know there's many opportunities for us ahead of us. So I want to thank you so much for your time today, and I hope you have a great rest of the day.
Thank you. Same to you, Sarah.
Thank
Bye-bye.
you. Bye. Thank you so much for listening. If you enjoyed this episode, please subscribe to this channel and tune in for more interviews with industry innovators. I'm your host, Sarah Cornett. Keep innovating.